Buenos días tengan todos ustedes. Soy el doctor Oscar Valencia, coordinador de este espacio de educación médica continua. En nombre de la Escuela de Medicina y Ciencias de la Salud del Tecnológico de Monterrey, les doy la más cordial bienvenida. On behalf of the School of Medicine and Health Science of Tecnológico de Monterrey, I welcome you to our weekly pediatric rounds. Today, it's our third lecture on pediatric infectious diseases. And today's lecture is going to be presented by Dr. Paul Offit. The vaccines have been most significant advance in public health, but still we have a lot of preventable diseases that are present in our community and around the world. And also we have outbreaks. Some parents choose not to vaccinate or selectively immunize their children, and we as pediatricians, we confront with this reality. During the pandemic, anti-vaccine issue reemerged and also were reloaded. Dr. Paul Offit will analyze some of the COVID myths and also will give us some advice to how to address this situation with the parents, with the politicians, with influencers, with the general public. Dr. Paul Offit, he's a pediatrician specialized in infectious disease, vaccine, and immunology and biology. He's a co-inventor of the rotavirus vaccine, professor of pediatrics of Perelman School of Medicine at the University of Pennsylvania, former chief of division of infectious diseases, director of he's the current director of Vaccine Education Center at the Children's Hospital of Philadelphia. Also, he's a member of at the Food and Drug Administration Pediatric Food Administration Vaccine Related Biological Product Advisor Committee, board member of Every Child by Two, a founding board member of Autism Scientists Foundation, former member of the Center for Disease Control Advisory Committee on Immunization Practice, and he has published more than 130 papers in medical and scientific journals and in the area of immunize, respond, and vaccine safety. He's a co-author of books on vaccination, rejection of medicine. These are the three of the books that I really recommend to the audience. And his most lately one was this one, who I'm sure is going to talk about Tell Me When It's Over. Dr. Paul Offit, it's an honor to have you in our grand rounds. So I'll give you the floor.
Thank you so much. Continue this. Advance it. Great. Okay, so I am going to sort of focus on COVID myths, which unfortunately restrict the degree to which people in the United States have been willing to vaccinate themselves and their children. So we are at a different stage of this pandemic. Most people have been either vaccinated or naturally infected or both. As a consequence, the incidence of COVID hospitalizations is declining, and the incidence of COVID deaths is declining. But COVID will be with us for decades, if not longer. There are 4 strains of circulating human coronavirus. One entered the human population in the late 1700s. Another entered the human population in the late 1800s. Those viruses are still with us. I think it's fair to say that SARS-CoV-2 virus will be with us for a long time. So we need to continue to protect those who are at highest risk. Now, every year in the United States, 3 to 4 million children are born who will be fully susceptible to COVID by the time they're 6 months of age, and the maternal antibodies that they receive through the placenta and to some extent through breast milk will have waned. About 9 million people cannot be successfully vaccinated due to immune suppression, so they depend on those around them for protection. The groups most likely to benefit from booster dosing or yearly dosing include people with high-risk medical conditions like obesity, diabetes, and chronic lung, heart, kidney, or liver disease, pregnant people, the elderly, and those who are mildly immune suppressed. So the continued onslaught of misinformation about vaccines will limit our ability to protect those who are most vulnerable. So when were COVID conspiracies first born? I think they were born with the so-called lab leak theory, the notion that SARS-CoV-2 virus was created in a laboratory. You can see here on this headline from this newspaper, coronavirus linked to China biowarfare program possible, analyst says. This was January 2020, right when COVID at least came into the United States. And at the center of this controversy is the Wuhan Institute of Virology. And the head of that institute, at least the chief virologist there, Shi Jiangli. So in the United States, Dr. Anthony Fauci, who was the head of the National Institute of Allergy and Infectious Diseases and a prominent spokesperson for vaccines and explaining the disease, had to testify in front of Congress in front of a Republican named Rand Paul. This is July 2021. So Rand Paul said, quote, Dr. Fauci, we don't know whether the pandemic started in a lab in Wuhan, but we should want to know. Instead, government authorities say there is nothing to see here. To arrive at the truth, the US government should admit that the Wuhan Virology Institute was experimenting to enhance coronavirus's ability to infect humans. The gain of function research has been funded by the National Institutes of Health. Dr. Fauci, do you still support the lab in Wuhan? Dr. Fauci said, Senator Paul, with all due respect, you're entirely and completely incorrect that the National Institutes of Health has ever done and does now fund gain of function research at the Wuhan Institute. So the first question is did the National Institutes of Health in the United States support coronavirus research at the Wuhan Institute of Virology? And the answer to that question is yes, we did. We did it through the ECHO Health Alliance. So then the second question, and the more relevant one, is did the Wuhan Institute of Virology perform gain of function experiments? In other words, did they take a virus and manipulate it so that it had properties that made it more virulent, more likely to be transmitted to humans? And the answer to that question is no. In 2016, Dr. Shi Jiangli was studying a coronavirus strain called WIV1, or Wuhan Institute of Virology 1, a bat coronavirus that could grow in monkey cells in the laboratory, but did not cause disease in people. The WIV1 strain bore no resemblance to SARS-CoV-2. Jiangli combined WIV1 with each of 8 different bat coronaviruses that had been found in caves in and around Wuhan. None of the combination viruses that she created were more dangerous than WIV1. So what you could say is that Shi Jiangli did do gain of function research, technically, because she combined different viruses, but no function was gained. In 2022, Michael Warby and coworkers, these are evolutionary biologists, found the epicenter of the outbreak, published a paper in Science that described it. The title of that paper was The Hunan Seafood Wholesale Market in Wuhan was the early epicenter of the COVID-19 pandemic. So this is just a picture of the Hunan seafood market in late 2019. And what they found really was that there was one or a couple stalls in the southwestern section of the Hunan wholesale seafood market that sold animals that were susceptible to SARS-CoV-2 virus, animals like raccoon dogs, palm civets, bamboo rats. They looked at the initial cases and the spread of those cases. And what they found was that the first 2 cases occurred directly associated with that stall in the southwestern section of the Hunan wholesale seafood market. You can see it there. And you see the little black square about 9 miles away that says WIV, which is the Wuhan Institute of Virology, which is 9 miles away on the other side of the Yangtze River. They found that when they looked at the first 39 cases, they all centered around that stall in the Hunan wholesale seafood market. Same thing was true of the first 85 cases. Same thing was true in the first 174 cases. And you can see that none of them were centered around the Wuhan Institute of Virology. So what you would have had to have argued was that someone created this virus in a laboratory and then traveled 9 miles to the Hunan wholesale seafood market and then proceeded to release the virus exactly where you would have expected an animal to human spillover event to occur, when that person or persons could have traveled to any other of 10,000 places in Wuhan. Then in March of 2023, the New York Times had this headline: "New data links pandemic's origins to raccoon dogs at the Wuhan market." In the southwestern section of the Hunan market, SARS-CoV-2 virus genome was detected in carts, drains, a feather and hair remover, a metal cage, and machines that process animals after they've been slaughtered. In the same specimens, researchers found mammalian DNA consistent with raccoon dogs, bamboo rats, and palm civets, all of which could have been intermediate hosts for bat coronaviruses to enter the human population. And remember, when these animals are being sold, they'll have about 50 human contacts a day. So it's easy to see how this could be the epicenter of a SARS-CoV-2 pandemic. What is most disappointing to me is that 2/3 of the US adults think that COVID likely started in a laboratory. And it doesn't matter your political affiliation. Democrats, independents, Republicans, all believe that that's true. And remember that in the history of humankind, there has never been a pandemic virus created in a laboratory. Now, there's been lab leaks. So, for example, there was a lab leak of smallpox in England many years ago. But there's never been a pandemic virus created in a laboratory. So if you believe Carl Sagan, that extraordinary claims should be backed by extraordinary evidence, this is an extraordinary claim that's backed by no evidence, just conspiracy and innuendo. So who cares? I mean, why is this issue important? It's important because in 2002, the SARS-1 pandemic caused 8,000 cases and 774 deaths. In 2012, the MERS pandemic caused 2,600 cases and 941 deaths. These are both pandemic coronaviruses. And beginning in 2019, the SARS-CoV-2 pandemic has caused more than 700 million cases and 7 million deaths, a million in the United States alone. There will be another pandemic coronavirus. There's been 3 in the last 20 years. We can assume this isn't the end of it. It is important to understand the exact origin of this virus to prevent or at least immediately respond to the next one. And this whole business of a lab leak theory only diverts attention away from the critical fact that this was an animal to human spillover event that occurred in Wuhan, China, in their seafood market. Okay, myth number 2, and this has gained a lot of traction in the United States, sadly, is that mRNA vaccines are contaminated with dangerous fragmented DNA. This is Marjorie Taylor Greene, who is a Republican member of the House of Representatives from Georgia, who held a hearing to look into COVID vaccine injuries. And at that hearing, she had 3 people that were presented. On the left, the woman there is Kimberly Biss, who's an obstetrician gynecologist. In the center, and we'll start with him, is Dr. Robert Malone. And then on the right is a lawyer named Thomas Renz. So this was a chance for the government, the Congress, to look at COVID side effects. So Robert Malone was the first to speak. Now, he had published 2 important papers in the Proceedings of the National Academy of Sciences in the late 1980s, showing that naked messenger RNA, when injected into mice, could be translated into proteins. This was a critical invention or discovery. Arguably, he could have been in line for the Nobel Prize. Nonetheless, something has happened to Robert Malone where he has kind of fallen off a cliff. He now claims that the mRNA vaccines that are made by Pfizer and Moderna were contaminated with fragments of foreign DNA that, quote, which could alter our DNA, causing cancer, autoimmune diseases, and a variety of other disorders. He claimed that, quote, DNA fragments could be used by the federal government to monitor who's been vaccinated and who hasn't, thus appealing to this sort of deep state notion of conspiracy, which is prevalent in the United States. Malone also claimed that the Food and Drug Administration, the Central Intelligence Agency, and other government agencies knew about this DNA contamination, but were covering it up. Quote, the CIA has its fingers all over this, he declared. Now, this sort of took off. So this is a picture of the Florida State a Surgeon General whose name is Joseph Ladapo, and he's put this out, and he's done it now a couple times, including within the past week, calling for a halt to the use of mRNA COVID vaccines. He says, quote, "The U.S. Food and Drug Administration and the CDC have always played it fast and loose with COVID-19 vaccine safety, but their failure to test for DNA integration within the human genome, as their own guidelines dictate, when the vaccines are known to be contaminated with foreign DNA, is intolerable." So in order to understand whether this claim is true, you need to understand how mRNA vaccines are made. Okay, so first, the first thing you do when you make this mRNA vaccine is you synthesize DNA that codes for the spike protein, because the spike protein is a cell attachment protein. If you can make antibodies directed against the spike protein, you will prevent the virus from binding to cells and causing infection or causing disease. So that's what you start with. You start with the DNA equivalent for the spike protein. Then you take that DNA that codes for the spike protein and you insert it into a piece of a plasmid that's composed of double-stranded DNA. Then you take that plasmid that has the DNA that codes for the spike protein and you put it into E. coli, the bacteria E. coli. You then grow the bacteria up in a fermenter, and as the bacteria multiply, the plasmids also multiply. So you're making millions of copies of these plasmids. Then you disrupt the bacterial cell with a detergent, releasing the plasmids. Then what you do is you take the plasmid and you cut it with an enzyme to release this linear piece of DNA that codes for the SARS-CoV-2 virus spike protein. And you do that with a restriction enzyme. Then, now that you have this, you take an RNA polymerase and you convert the DNA to messenger RNA. Now you have all these pieces of messenger RNA that you treat with DNase to dramatically lessen the quantity of fragmented DNA that is contained in this product. So you reduce it, but you don't eliminate it. You then take this messenger RNA and you encapsulate it in lipid nanoparticles. Now, the paper that sort of gained the most attention, that caused people like Robert Malone or like Joseph Ladapo in Florida to seize onto the notion that the mRNA vaccines are quote unquote contaminated with foreign DNA, when we probably should more accurately say contain small fragments of foreign DNA, was this paper by David Spiker. So what he found was that DNA fragments in Pfizer's mRNA vaccine occur at a level of about 0.28 to 4.27 nanograms per dose. So a nanogram is a billionth of a gram. They also found DNA fragments in Moderna's mRNA vaccine at 0.25 to 0.78 nanograms per dose. So these trace quantities of DNA fragments are contained in many biological products. Frankly, anything that starts with cells will have residual DNA fragments in it, including viral vaccines like the measles vaccine, the mumps vaccine, the rubella vaccine, the varicella vaccine, the rotavirus vaccine. So can these DNA fragments that are contained in the vaccine affect our DNA? One person who sort of went through this and I thought did a nice job was a guy named Dan Wilson, who's a molecular biologist who has a podcast called Debunking the Funk. And what he did is he took this issue on with, this is Dr. Joseph Ladapo, who's the Florida State Surgeon General, to try and explain to the public in America why this doesn't make any sense. So first of all, DNA fragments would have to enter our cytoplasm, where they would quickly be destroyed. As is shown in this paper that was published in Immunity, immune sensing mechanisms discriminate self from altered self and foreign nucleic acids. So in other words, DNA fragments, were they to actually enter our cytoplasm, would be quickly destroyed. All life forms have developed highly sophisticated systems to detect altered self and non-self nucleic acids, and including foreign nucleic acids. So to effectively respond to pathogens, maintain host integrity, and eliminate foreign DNA, cells have a highly regulated network of innate immune responses, restriction factors, nucleases, and cell death pathways. So these small fragments of DNA would probably never get out of the cytoplasm and much less be able to enter the nucleus and affect our DNA. And it's virtually impossible for DNA fragments to enter the nucleus of a non-dividing cell. This is a paper in gene therapy you can see called Nuclear Entry of Non-Viral Vectors. Non-viral gene delivery is limited to a large extent by multiple extracellular and intracellular barriers. The main barrier is that it's extremely difficult for DNA to enter the nuclear envelope or cross the nuclear envelope of a non-dividing cell. And so when we have DNA vaccines, and there are DNA vaccines, there's a DNA vaccine in India that's used to prevent COVID. You have to electroporate the muscle. In other words, you essentially put an electric shock into the muscle to damage the nuclear membrane to allow DNA to enter. It's very hard for foreign DNA to enter the nucleus. Secondly, even if these foreign DNA entered the nucleus, which is virtually impossible, it's difficult for those fragments to integrate into our DNA without an integrase. So in this paper called Detection and Integration of Plasmid DNA into Host Genomic DNA, it's clear that from gel purification results that 99.5% of the DNA that is in the electroporated sample is extrachromosomal, meaning it doesn't insert itself into DNA. So even if you electroporate, if you send an electroshock into cells, which we don't do when we give COVID vaccines, it's still very, very hard to get DNA to insert itself into the chromosome. And DNA fragments in mRNA vaccines can cause cancer. They're not oncogenes. Oncogenes cause cancer. These are not oncogenes. The plasmid DNA that we start with here contains no oncogenes. Also, the amount of oncogenic DNA, even if you started with an oncogene that would be necessary to transform cells and make them cancerous, is exponentially greater than those contained in vaccines. Here you can see in this particular paper, it took 12 micrograms, which is a millionth of a gram, not nanograms. So it's at least 1,000-fold difference to even do that, so making it all the more unlikely. So that's why the acceptable limits have been set between 100 picograms per dose, which is a trillionth of a gram, and 10 nanograms per dose. So you can see even the quantity of fragmented DNA that's in these vaccines is within acceptable safety limits. Also, and this is the part that I find the most amusing, we are constantly exposed to foreign DNA. Everybody who lives on this planet, which is all of you, and who eats anything made from vegetables and animals on this planet, which is all of you and me, obviously is consuming foreign DNA all the time. And that foreign DNA enters our circulation. Complete genes may pass from food to human blood. So in an analysis of more than 1,000 human samples from 4 independent studies, researchers found that meal-derived DNA fragments large enough to carry complete genes, which is not true of this fragmented DNA, ACE-treated DNA, can avoid degradation and enter our circulation. The relative concentration of plant DNA in the circulation is higher actually than human DNA. Authors concluded that, quote, the presence of foreign DNA in the human plasmid is not unusual. And we have trillions of bacteria that live on the surface of our bodies that contain foreign DNA. Unfortunately, when you say the phrase foreign DNA, that scares people, and it makes them think that this DNA is going to hurt us when we're always exposed to foreign DNA. Okay, the other person that testified in front of this hearing last year is Kimberly Biss, shown there on the left. So she's an obstetrician gynecologist who's the chief of staff at Bayfront Hospital in St. Petersburg, Florida. And this is the part that's the most upsetting, is that it's not just sort of cranks and hucksters that are putting forward these outlandish notions. They're MDs and PhDs and people who are accomplished in their field that are putting forward these false notions, which makes it all the more difficult to refute them. Biss claimed that after receiving COVID vaccines, women in her practice suffered menstrual cycle irregularities, including severe bleeding. She testified that, quote, her miscarriage rate went up 100%. She claimed that she, quote, had never seen a pregnant woman die from COVID. Therefore, we must assume that pregnant women don't die from COVID. And she stated that, quote, only 3 in 1 million children will die from COVID. So why are we giving children these vaccines? So we'll take them one at a time. The first myth is that COVID vaccines cause menstrual cycle irregularities, including severe bleeding. So this was studied, and this is a paper that was published in the journal Vaccine. Boston University School of Public Health study of more than 1,100 participants who did or didn't receive COVID vaccines. They looked at menstrual cycle characteristics that were studied, including cycle regularity, cycle length, bleed length, heaviness of bleed, and menstrual pain. Participants had a 1.1 day longer menstrual cycle length after the first dose of COVID vaccine and 1.3 days longer cycle after receiving the second dose. This association returned to baseline for the second cycle. No associations were found for cycle irregularity, bleeding length, heaviness of bleed, or menstrual pain. Next myth was that COVID vaccines cause miscarriages. So this again was studied in this paper in Morbidity and Mortality Weekly Report titled Receipt of COVID-19 Vaccine During Pregnancy and Preterm or Small for Gestational Age at Birth from 8 integrated healthcare organizations in the United States. So this was from the Yale University School of Medicine studying 46,000 pregnant women between 2020 and 2021, vaccinated between the second and third trimester. COVID vaccination was not associated with either preterm births or small for gestational age births when compared with pregnant women of the same age who were unvaccinated. And this just shows the same thing through the so-called V-Safe system in the United States, showing that there were no differences between a vaccinated and not vaccinated group of pregnant women in terms of pregnancy outcomes, like miscarriage and stillbirth, in terms of pregnancy complications, like gestational diabetes, preeclampsia or eclampsia, or intrauterine growth retardation, or anything regarding neonatal outcomes, such as preterm births, congenital abnormalities, small for gestational age, or neonatal deaths. The next myth is that pregnant women are not at increased risk of dying from COVID. This was a study published in the British Medical Journal that looked at this, at outcomes of pregnant women who were infected. What they found was in this review of 435 studies involving 293,000 pregnant women compared with 2.9 million non-pregnant women, that pregnant women with COVID were 2.5 times more likely to be admitted to the intensive care unit and require mechanical ventilation, and 6 times more likely to die than non-pregnant women with COVID. Pregnant women with COVID were also more likely to deliver prior to term, and their babies were more likely to be admitted to the neonatal intensive care unit. The next myth that Dr. Biss spouted in front of this congressional hearing was that young children don't need a COVID vaccine. So this was a study published in the Journal of the American Medical Association looking at COVID-19 deaths in children. What they found, Biss had claimed that only 3 in 1 million children died from COVID, so why are we vaccinating children? I guess 3 children was acceptable for her to die. But the JAMA study of 821 children who died from COVID found a death rate of 43 per million in children, not 3, in those less than 1 year of age, and 6 per million in children 1 to 4 years of age. The authors concluded that, quote, among children and young people less than 19 years of age in the United States, COVID-19 ranked 8th among all causes of deaths, 5th in disease-related deaths, and 1st in deaths caused by infectious or respiratory diseases in the heart of this pandemic. The next myth, and this has also been widely circulated, is that the spike protein, the protein that's used to evoke neutralizing antibodies, is itself toxic. Again, it's an MD who's promoting this, a guy named Dr. Peter McCullough, who's a cardiologist and chief of the Division of Preventive Medicine at the William Beaumont Hospital in Michigan. And he bases this statement on a paper that was published in Circulation Research in 2021 called SARS-CoV-2 spike protein impairs endothelial function via downregulation of ACE2, which is the binding receptor for SARS-CoV-2. So this was a study of Syrian hamsters inoculated intratracheally with 500,000 plaque-forming units of vesicular stomatitis virus, or a pseudovirus, expressing SARS-CoV-2 spike protein. They found that evidence for endothelial damage in the lungs. The authors' claim chose, however, an unusual route of inoculation, an extremely high quantity of pseudovirus, and an animal model to make predictions about people inoculated with mRNA vaccines, which is not exactly an analogous story. The authors admitted that, quote, the use of non-infectious pseudovirus is a limitation of this study. I think that was the least they could have said. This is in no way predictive of humans. There's an old saying that from a DNA vaccine researcher at the Wistar Institute here in Philadelphia, where he says, regarding animal model studies, mice lie and monkeys exaggerate. Okay, now moving on to myths that frankly cross the line into parody. We have the Centner Academy, ironically called the Brain School in Miami, Florida. This article from the Associated Press, private Florida school won't employ vaccinated teachers. The Centner Academy. In October 2021, 5 months after COVID vaccines had been approved for everyone more than 12 years of age, David Centner, the head of the Centner Academy, prohibited vaccinated teachers from the classroom for at least 30 days because of his fear of vaccine shedding, that you would get the vaccine, that the mRNA would make spike protein, the spike protein would then be shed from your body and would cause harm. Quote, this is from David Centner, "It is in the best interest of the children to protect them from the unknown implications of being in close proximity for the entire day with a teacher who has very recently taken the COVID-19 injection," end quote. A few months later, Centner also banned vaccinated children from attending school for 30 days. This school, by the way, invited Robert F. Kennedy Jr. to come speak there, and he did. But think about this for a second. Consider the logic of what David Centner just said. The mRNA vaccines contain a small piece of genetic material that serves as a blueprint for the cell to make the SARS-CoV-2 spike protein. When the vaccine mRNA enters our cells, it joins about 200,000 other pieces of mRNA that are making the proteins and enzymes necessary for life. If it were true that these proteins were quote unquote shed from the body and transferred to someone else standing nearby, imagine what that could mean. Insulin-dependent diabetics could just stand next to someone who was making insulin, freeing themselves from painful insulin injections. Or people with sickle cell disease could just stand next to someone making normal hemoglobin, no longer requiring frequent hospitalizations for blood transfusions. It was, of course, absurd. Centner's prohibition of vaccinated teachers and students from the school shows just how easily people can be seduced by magical thinking. Indeed, one math and science teacher at the Centner School urged students not to hug their vaccinated parents for more than 5 seconds to avoid the shedding problem, the 5-second rule. Okay, next, COVID vaccines cause people to become magnetic. So this was promoted by Dr. Sherry Tenpenny, who is seen here testifying in front of the Ohio State Assembly, that was considering enacting a vaccine choice and a mandate. And so why should we mandate vaccines if they're causing people to be magnetic? So she's making that claim. And to support her claim, she had a woman come up and say, see, I got a vaccine and now this key is sticking to me. I'm magnetic. So let's take a look at this. mRNA vaccines contain lipids, potassium chloride, monobasic potassium phosphate, sodium chloride, dibasic sodium phosphate dihydrate, and sucrose, none of which are paramagnetic. Physicist Michael Cooey has stated, quote, "You would need about 1 gram of iron metal to attract and support a permanent magnet at the injection site, something you would easily feel if it was there," end quote. Joe Schwartz, who's a PhD from McGill University and has written many books actually trying to make the chemistry, the science of chemistry easy to understand, said, quote, "Our liver, which is loaded with iron, isn't ripped out of our body when we get an MRI scan. And people who get iron injections or take iron supplements, which do contain ferrous or ferric ions that are paramagnetic, do not become magnetized." And he showed you how easy it was to get metal to stick to you because our sebaceous glands make sebum, which can be sticky. So there he is, Joe Schwartz, showing how easy it is to show that you can become magnetic. So I'll close here with this quote from Pogo. "We have met the enemy and he is us. It is very frustrating that we are constantly fighting ourselves. MDs and PhDs, or people who are MDs and PhDs, who are constantly setting themselves up there to misinform the public. And I would argue disinform the public, meaning that they're providing information that they know is incorrect." And so I will stop there. That's our website at the Children's Hospital of Philadelphia for more information and take any questions you might have.
Thank you very much, Dr. Paul Offit, for your excellent presentation. And there's some questions from the audience, and one of them is, can you address some of the concerns of vaccine mandate and exceptions?
Yeah, I think so. If you'd asked me at the beginning of this pandemic, how did I think people would react to vaccines? I would have thought they they were what they are, which is a lifesaver. I mean, think about it. In 2020, when this virus entered our countries, we didn't have anything. We didn't have antivirals till October. We didn't have monoclonals till November. We didn't have vaccines till December. We had nothing to try and prevent a virus that was spread asymptomatically, was highly contagious, and fatal. And I would have thought that when we finally had vaccines, that vaccines would be welcomed with open arms. That if anything, it would kill the anti-vaccine movement, which had for years been claiming, you know, why should I get a vaccine against diphtheria? Why should I get a vaccine against polio? Show me a pandemic, and then I'll get vaccines. And so at least in the United States, we very quickly were able to vaccinate about 70% of our population, 70% by July. So within 7 months, we vaccinated 70% of our population. Then we hit a wall. 30% of the country refused to be vaccinated. They didn't think the disease was that serious. They thought the vaccine was unsafe, and they refused to be vaccinated. And so then we were left with the question, do you mandate vaccines? You shouldn't have had to. I think anybody who knew the data on these vaccines would have gotten them. I think I knew the data. I was on the FDA Vaccine Advisory Committee. I looked at 800 pages of data that were presented to our committee in December of 2020. I think I was a well-informed vaccinee, and I couldn't wait to get vaccinated. Nonetheless, 30% of people in this country said, this is my choice. This is a personal choice, which would be true if this wasn't a contagious disease. I mean, is it your right to catch and transmit a potentially fatal infection? I mean, in 2021, you were 12 times more likely to be hospitalized and die if you didn't get vaccinated than if you got vaccinated. In 2022, you were 6 times more likely to be hospitalized and die if you didn't get a vaccine than if you got one. Was that your right? Also, remember, 9 million people, at least in our country, can't be vaccinated. They depend on those around them to protect them. Do you have any responsibility for your neighbor? Yes, you do. So we mandated vaccines. And I think what happened was we leaned into a libertarian left hook because we mandated vaccines and for school entry, because we did things like shutter schools, close business, restrict travel. People couldn't get into their favorite bar or restaurant unless they showed their vaccine card. We really caused a lot of anger in this country. And as a consequence, hundreds of pieces of legislation have been introduced in the last few years to eliminate mandates, not just COVID mandates, but all school mandates. And as a result, there's been an erosion in vaccine rates. We went from 50 cases of measles last year to 200 cases this year. And that's because of an erosion in mandates, because we really made people angry when we mandated vaccines. I think it was the right thing to do at the time, but I was sitting next to Nancy Messonnier at Rosalind Carter's funeral in Atlanta months ago, and she said to me something that surprised me because she's the head of the National Center for Immunization and Respiratory Diseases in our country. She said, I wish we'd never mandated these vaccines because of what has been this major pushback against all vaccines. I think we really upset people because they felt we had violated their personal liberties. And I'm not sure how we should have done this differently. Maybe if we didn't mandate vaccines, the same number of people would have gotten vaccinated. But I can understand how we have really upset people by mandating vaccines. But on the other hand, I don't think we should have had to. But was it your right to catch and transmit this infection? I don't think so. And especially at the beginning of the pandemic, we were overwhelmed with this virus. I mean, we had 3 floors of COVID. We had trouble taking care of those patients. We had trouble taking care of our other patients. We eliminated elective surgeries. And so people were perfectly willing not to be vaccinated, and they would come into our hospital and expect us to take care of them because, you know, they were sick. Well, why don't you do your part and get vaccinated so that we don't have to take care of you? this was a very emotional issue for all of us, and I wish I had a clear answer to your question. I certainly know that that mandates upset a lot of people, and as a consequence, I think that the next pandemic that comes, and there'll be another pandemic, I think in many ways we'll be less prepared because people are much less willing to get wear a mask, or much less willing to get a vaccine because of what we did in this most recent pandemic.
Yeah, that erosion concept, it's very important because that's what we're living and experiencing in our country also. Another question is, should everybody continue to receive a COVID vaccine yearly? What was the result of bivalent vaccine last year?
So the goal of this vaccine is to keep people out of the hospital, keep them out of the intensive care unit, keep them out of the morgue. That's the goal. It's not to prevent mild disease or moderate disease. It's not. I mean, this is a short incubation period mucosal infection, like rotavirus, respiratory syncytial virus, influenza virus. You're going to get mild infection again and again. So the question then becomes, who is getting seriously ill? Who is getting hospitalized, and who is dying from this virus? And the answer is it really falls into 4 high-risk groups that I outlined earlier in this talk. Pregnant people, people who are immune compromised, the elderly, which I'm defining as people over 75 because I'm not there yet, and actually the UK data were people over 80, meaning elderly without any other high-risk medical conditions. And then people who have high-risk medical conditions like diabetes, obesity, chronic lung, liver, heart disease. So that's who's getting hospitalized. So I think those are the people who should get a yearly vaccine. Now, in our country and in Canada, the recommendation is everyone over 6 months of age, but that's not most countries. Most countries recommend this for high-risk groups, like Western European countries, Australia, Scandinavian countries. The World Health Organization recommends this vaccine to be given yearly for high-risk groups. Well, I talked to Dr. Fauci about this, I mean, who's a friend, and because I have been fairly public about how I think we should vaccinate high-risk groups and not everybody. And he agreed with that, but he said that when you make a recommendation for everybody, those high-risk groups are more likely to be vaccinated. I'm not sure that's necessarily true. It's testable, but that was sort of the thinking. The thinking is that making a recommendation for high-risk groups is sort of a nuanced message, and a nuanced message would be a garbled message. I don't know. I mean, I don't think a healthy, 16-year-old male who's been vaccinated and probably naturally infected needs a yearly dose of vaccine. I think also we tend to underrate T cells. We only talk about antibodies because when we're talking about these variants, which continue to evolve, obviously, we're talking about escape from, to some extent, recognition by antibodies. That's what you're talking about. But you're not talking about escape from recognition by T cells. I mean, T cells are recognizing conserved regions on the nucleoprotein and on all 4 proteins. And T cells are important. T cells are important in protection against severe disease. I mean, if you look at people, for example, who have B cell deficiencies, or people who are getting anti-CD20 monoclonals, which will eliminate their B cells, they still are protected against severe disease. Why? Because they can make T cells, especially cytotoxic T cells, which are critical for protection against severe disease. So even though this virus continues to evolve, you see that the incidence of hospitalization is down, the incidence of death is down, primarily because of T cells. I mean, there's a podcast in the United States called This Week in Virology, and it's headed by a virologist at Columbia University named Vincent Racaniello, who brought up on a recent episode what would have happened if we never created new vaccine strains, if we just stuck with Wuhan 1, that every year we just continued to give vaccines that contain the ancestral strain. Would we still have the same outcome? And he postulated that we would still have the same outcome because there's no difference in T cell recognition sites from the Wuhan 1 strain, the ancestral strain, to the current strains, including the XEC strain, which is getting a lot of play now in Europe.
Thank you. Another question is, how do you personally talk with vaccine hesitate parents that are not a scientist? Should we pick up our battles when we are in front of anti-vacciner parents, or try to do something to protect the children?
Well, so I guess I would divide. I would say that there's anti-vaccine parents, and then there's vaccine hesitant parents. I think most of the people who ask me questions, I would put in the category of vaccine hesitant. meaning they've smelled the smoke. They want to know whether there's any fire there. They've read a lot of bad information about vaccines, and they want to know whether or not it's true. And they're open to the fact that it's not true, that vaccines are safe and effective. And I think you do try and explain the science as simply and compellingly and compassionately as possible, because it is hard. I mean, I understand, at least in our country, you know, we give vaccines in the first few years of life that prevent 14 different diseases. That can mean as many as 25 inoculations during that time. To prevent diseases most people don't see, using biological fluids most people don't understand. So I understand the pushback on vaccines. So I'm sympathetic to that. And I think you have to be sympathetic to that and try and explain science as best as you can. You have to explain the science at some level. Because if you don't do that, then what you're just saying is trust me. Trust me, I vaccinate my own children. I know these are safe. And I think you have to do more than that these days. I think you have to, as I've done in this talk, some level try and explain the science simply. I mean, when I had to, when this business with DNA fragments causing cancer raised its head in Florida, I had to appear on CNN with Breonna Keeler to try and explain why that wasn't true. And so I had basically 4 minutes to explain what I spent 15 minutes explaining to you. And I think I did a reasonable job of trying to say, look, it's hard for these DNA fragments to get in to the cell, much less get into the nucleus. It's virtually impossible for them to insert themselves into your DNA. And here's why. And we all ingest foreign DNA all the time. And so I went through that for 4 minutes, and she said, that's great. She said, well, how come people don't understand that? Good question. So I do think you have to explain. Now, the second group are anti-vaccine activists. Forget it. I mean, they just think there's a conspiracy. They think you're a part of it. I have had people have just basically, it doesn't matter what I say. And it really, I can tell that in the first 30 seconds. I'll often say, is there anything I can say to you that will change your mind about this? And if the answer is no, then I don't waste either of our time.
Thank you. Another question is, will you say that sociological research is a possibility to bridge the gap in what science is capable of providing versus what the community is willing to comply?
I'm sorry, I missed the second part of that question.
Let's see, if it's possible to be a bridge in what science is capable of providing versus what the community is willing to comply.
I see. Yeah, I mean, it's, I think if you use this vaccine as an example, I think we did a decent job of explaining what this vaccine could do, but we didn't do a decent job of explaining what it couldn't do, which is to say 6 months after this vaccine came out, you were unlikely to be protected against mild illness. And we didn't explain that. And we didn't explain that it's probably not going to do a great job at preventing transmission. Because we wanted people to get vaccinated. So we overrated the vaccine as if it was going to just make the virus bounce right off you, which wasn't true. In fact, we called asymptomatic or mild infections in people who were vaccinated breakthrough infections. Wrong phrase. I mean, that explains, the breakthrough implies failure. This wasn't a failure. This was success. I mean, if you got a vaccine and you had an asymptomatic or a mild infection, you won. And I don't think we really explained that well. Also, the bivalent vaccine, which we used in this country in 2022, was a mistake. I mean, it was no better than what we had. That notion of a half dose of the Wuhan 1 strain and a half dose of the Omicron strain was a bad idea. We couldn't sort of overcome the imprinting hill. And so it was no worse than what we had, but it was no better than what we had. And, you know, there were papers that clearly showed it was no better. And so that's the other part of this that makes it hard, which is you learn as you go. You do. I mean, there's not a medical innovation ever that has not been associated with some human price that had to be paid for knowledge. And that was true here too. I mean, we didn't anticipate that myocarditis, heart inflammation, was going to be a consequence of mRNA vaccines, although generally it's short-lived and self-resolving. But look at the Johnson & Johnson vaccine, the adenovirus vectored vaccine. I mean, that was associated with clotting, including clotting in the brain, including fatal clotting in the brain. And it occurred in 1 in 200,000 people. So it's not going to be picked up pre-licensure or pre-authorization. It's only going to be picked up later. And people see that and they go, you know, you can't trust these people. They didn't know about this. But the notion that you always learn as you go is not tolerable to people. And so how do you bridge that sociological gap? I don't know. It's really, I wrote a book called You Bet Your Life, which goes through the fact that every medical innovation ever has been associated with a human price. I mean, look at gene therapy. in Pennsylvania, we have Jesse Gelsinger, a boy with ornithine transcarbamylase deficiency, died of human gene therapy. And so we learned something. So now we know to give, tocilizumab, an IL-6 monoclonal, which saved the lives of many people since him. And it's interesting, if you go to the laboratory that does CAR T therapy in Philadelphia, they have all these pictures of their first big success. A little girl named Emily Whitehead who had leukemia, and she was saved really by gene therapy. But you don't see any pictures of Jesse Gelsinger, the guy who died, because we never are comfortable with the failures that are frankly necessary for our successes. So what you're asking is a hard question. I think if I ask people in this audience, do you think we're going to know more 50 years from now about medicine and science than we know now? I think you would all say yes. But when it comes to your disease, or in this case, our pandemic, people want to believe you know everything you need to know, and that's not true. You make decisions when you think you know enough, not when you think you know everything, because you never know everything.
Thank you. Another question is, do you think there is money behind the anti-vaccine movement?
God, yes. Yes. I mean, you look at groups like the Informed Consent Action Network, or Robert F. Kennedy Jr.'s Children's Health Defense. You look at Barbara Fisher's National Vaccine Information Center. They have millions and millions of dollars, often from private donors, who believe they're right, that vaccines cause harm. I mean, billionaires support these people. And let me put it this way, it's a good business. The misinformation business is a lucrative business. If you're trying to make money, go into the misinformation business. It's much more lucrative than the information business. And yes, that's part of the problem. That's why it's gotten worse. First of all, it's much easier to access misinformation and disinformation. And with the money behind it now, it makes it even easier. I mean, I just feel like it's much, much harder to get our message out there. We're in the not lucrative information business than otherwise. You look at somebody like Robert Malone, who has a Substack, this sort of newsletter he puts out. He makes $30,000 a month doing that. I also have a newsletter. I make nothing.
Well, thank you. Thank you very much, Dr. Paul Offit. Would you like to make a final message of take-home message for the audience?
Yeah, I'd like to sort of end with a message of hope, okay, instead of being all sort of gloom and doom. I'll give you, I think that there was a politician in the United States named Tip O'Neill who once said all politics is local. I think that's also true of medical education. I think medical education and education about vaccines is also local. So I think the private pediatrician is key. But I'll give you an example. In Philadelphia, when COVID hit, there was an African-American surgeon whose name was Ayla Stanford, who took it upon herself to form something with her own money called the Black Doctors COVID Consortium. And she went into North Philadelphia, a predominantly Black and brown community, and with 200 other people, at her expense, sat in people's living rooms and tried to explain to them why it was important for them to get vaccines. Now, these people didn't often have physicians, and so she provided a physician who frankly looked like them to answer their questions. She went back again and again and again until she finally got 50,000 people in North Philadelphia to be vaccinated. So she was a point of light during this pandemic, where we should have thousands of points of light. But I think that's really what it matters, where it matters is sitting down and really trying to explain to people. And often it's hard for the pediatrician because they're seeing 30 patients a day and they don't have that much time with the patient to sit down and have that kind of discussion. But I think those discussions are critical, actually, in terms of getting our point across.
Well, thank you very much, Dr. Offit. It has been a great honor to have you in our grand rounds. Now that we're celebrating our 35th anniversary of weekly grand rounds, and it's been an honor to listen to you and listen for advice for our daily basis. So thank you very much.
Thank you. It was my pleasure.
Okay. This is a photo with Dr. Offit 10 years ago at San Diego. Thank you very much and have a good day.
Thank you. You too.